Chairman Wicker, Ranking Member Schatz, and members of the committee, I thank you for the opportunity to appear today to discuss how we can work together to advance telehealth through connectivity. My name is Kristi Henderson, and I serve as the Chief Telehealth and Innovation Officer at the University of Mississippi Medical Center. Telehealth in our state is increasing access to care, improving health outcomes, and lowering cost. Nowhere in America are healthcare challenges greater than in Mississippi. Not only do we lead the nation in prevalence of multiple chronic diseases, we also have the lowest number of doctors per capita. More than half of the state's 2.9 million citizens live in a rural community, and almost a quarter live at or below the federal poverty line. Telehealth is a vital tool in delivering health care. The UMMC Center for Telehealth began in 2003 with the Telemergency program connecting community emergency physicians to our trauma center. This program has resulted in a 25% reduction in rural emergency room staffing cost and a 20% reduction in unnecessary transfers, and has produced patient outcomes in rural hospitals that are on par with that of the academic medical center. 12 years later, telehealth technologies deliver over 35 medical specialties to 166 sites across the state, including community hospitals and clinics, mental health facilities, schools and colleges, corporations, prisons, and even the patients' homes. The network connects to sites in 52 of the state's 82 counties and serves an average of 8,000 patients per month. As we work to expand telemedicine services, we continue to run into two primary obstacles: reimbursement parity for telehealth services and connectivity challenges. Prior to 2013, insurance companies in Mississippi did not reimburse equally for telehealth services. We argued that Mississippi would ultimately save money by providing reimbursement and undertook a series of pilots to prove it. We were successful. In 2013 and 2014, Governor Bryant signed legislation mandating that health insurance companies pay for telehealth services at the same rate as in-person services. These changes at the state level were the catalyst for the rapid growth of our state's telehealth system, and I strongly believe adoption of reimbursement parity at the federal level would have a greater impact. The second obstacle we encounter is insufficient connectivity. Due to the largely rural nature of our state, we cannot take for granted that support for telehealth services will be available at the level we require, or frankly at all. To ensure connectivity, we partner with cable, wireless, and broadband telecommunication companies in the state to maximize our existing resources and leverage the strength of incumbent utilities. Through these partnerships, we are able to bring much-needed health care to rural Mississippi. Nothing tells this story better than the Diabetes Telehealth Network program. Last fall, we partnered with public and private stakeholders to launch a groundbreaking research pilot aimed at managing 200 uncontrolled diabetics in rural Sunflower County through aggressive in-home monitoring and intervention. The goal is to improve the health of participants while reducing cost of care. People in this program were sent home with electronic tablets that monitor glucose on a daily basis, provide education, information, and transmit this health data hundreds of miles away to specialists at our center. Many of our patients have never used a computer, and some can't read beyond a 6th grade level. But despite those challenges, our patients are thriving. Preliminary results show that the majority of patients have already met or exceeded the goals set for the end of the year-long study. With the exception of one patient, no one has been hospitalized or sent to the ER because of their diabetes since entering the program. But let me be clear, this connectivity between the providers and the patients would not exist but for the Universal Service Fund support that this region enjoys. This is true for many parts of our state where we serve, and it is critical for our continued success. As we look to expand this pilot, our biggest concern is the ability to connect with patients in their homes and communities. Despite our needs remain the same: increased reimbursement parity and continued access to reliable, high-quality connectivity. Given the jurisdiction of this committee, I urge you to consider 3 issues: the need for continued support of universal service funds, the need for broader application of the FCC E-rate program so that we can use telehealth services in the schools and take advantage of the E-rate program, and then the need for a more inclusive Healthcare Connect Fund. As a large hospital, we don't enjoy the pleasures of the full benefits of that program. So I thank the committee for the opportunity to testify, and I'm happy to answer any of your questions that you may have.